Welcome to Between the Sheets, the podcast where we're going to cover a variety of topics related to sexual health and wellness. I'm Dr. Stephanie Zwonitzer, your host. I'm a nurse practitioner and have been in practice since 2017. I have my Doctor of Nursing Practice degree, and I specialize in urology and sexual health. I am so excited to explore all of the various topics related to sexual health and wellness with you in a fun, spicy, educational, and non-judgmental manner. So come on. Let's get between the sheets. Hey everybody, welcome back. Very excited for today's topic, erectile dysfunction. It is one of my favorite things to treat, and it's very fun to talk about. It's also extremely common, and so it's definitely something that needs to be talked about early and often. So we will most likely do multiple episodes on this, but I definitely want to get you started on going through some of the things. So what is erectile dysfunction? It is an inability to obtain or maintain an erection consistently. Okay, one off here and there, not the problem if it's consistently happening. And it also happens in greater than 50% of the men. I can't tell you how many men I treat for this on a very regular, probably daily basis. So it is very, very common. Do not feel bad if this is happening to you. Let's go through some of the causes. So it can be related to other issues going on in your body, heart disease, high blood pressure, high cholesterol, diabetes and obesity, Parkinson's or multiple sclerosis, Peyronie's disease, which I'll explain later and also have another episode on. And it can also be caused by medication. So there's a plethora of them, but some of them are antidepressants. That's a big one. In fact, to the point where we use antidepressants for premature ejaculation because they can delay orgasm so long and have erectile issues. Antihypertensives, anti-ulcer medications like Protonix or Pepcid, prostate medication called finasteride, tranquilizers, diuretics, antihistamines, which a lot of us use for allergies. So if you're getting ED during allergy season, think about your antihistamine. Excuse me, Parkinson's drugs, prostate cancer medications drop your testosterone to the point where getting an erection is almost impossible, anti-seizure medications, and muscle relaxers. In addition to medications, it can also be alcohol and tobacco use or illicit drug use. You've heard of whiskey dick, cocaine dick. They don't work right if there's too many toxins in the body. Sleep disorders can cause this, injuries or surgeries, and then low testosterone. We'll have another episode on low testosterone as well, so we can really get into that because there are some great ways to treat low testosterone. Physiologically, there are also ways that erectile dysfunction can occur. So depression and anxiety, PTSD and trauma, stress issues, relationship issues, work or financial stress, all of those things can decrease your ability to get an erection. I tell my patients all the time, you guys' head-to-head connection is very strong. So anything that's messed up in the big head, the little head doesn't want to work right. So getting that worked out can help as well. Prevention of erectile dysfunction is getting exercise, especially moderate to vigorous exercise multiple times a week really increases blood flow, which can keep those blood vessels to the penis nice and healthy and working well. You want to eat healthy, a good, well-balanced diet. Eat from the perimeter of the grocery store, not the inside of the grocery store where all of the processed foods are. Get quality sleep, 8 hours of quality sleep a night. If you have sleep apnea, wear your CPAP. If you are stressed or not giving yourself enough time to sleep and you're having erection issues, get better sleep hygiene. Keep your comorbidities controlled, meaning diabetes, high blood pressure, all of those things. Keep those all under control as best as you can. Stop smoking or drinking, or at least cut back. Get regular health checkups so you can early diagnose any problems that are coming up. Reduce your stress, and therapy. Therapy is one of my favorite things. You can go to stress therapy, you can go to sex therapy, you can go to couples therapy. There's all kinds of different therapies out there. There are some fantastic therapists out there. So definitely work through that. I know I love having a therapist and getting therapy to work through plenty of things, and it does make me less stressed and a better person. So it can work for you and your erectile dysfunction as well. Working up erectile dysfunction. So all of these different things can cause it. Really, a lot of you don't care what causes it. You just want it fixed. But we do want to make sure that we know exactly, what's going on. Is it a blood flow issue? Is it a nerve issue? Is it one of your other disease processes or your medications? So we're going to check your other medications and diseases, see where you're at with things. We're going to get a cardiovascular workup for you, especially if you're having this at a younger age. We want to make sure that you're not having any clotting of your vessels, that everything is flowing well, and we'll also check you for low testosterone, as that can contribute. And sometimes we'll do a penile Doppler to actually look at the blood flow of the penis. That's not done as often anymore, just because it doesn't really matter whether or not the blood flow is there. If you're having erection issues, we have certain ways to treat that. Whether there's blood flow issues or otherwise, there's still the same treatments. But there is a penile Doppler. It's an ultrasound of the penis to look at the blood flow, and that can help understand what's going on, whether you have backflow, which is called venous leak, or if there is getting any blood flow there at all, and that can help you determine which type of treatment might be best for you. So let's get into some treatment. Obviously, if this is a problem for you, you want it fixed, or you want your partner to get it fixed if it's your partner with this issue, right? So conservative treatments. Exercise, again, moderate to vigorous, get that blood flowing. Reverse or improve your other diseases. So get your blood pressure back under control. If the medication that you're currently on is causing problems, have your cardiologist or your primary care provider switch that up and try a different one. But do not just stop a blood pressure medication just because it's giving you ED. Work with your provider so that your heart health can stay there as well. Stop drinking alcohol and using tobacco. Cut back on them if you are using them and unable to stop. And then sex therapy certainly is a great conservative method as well. So when those aren't working anymore, we can move on to treatment. So the first treatment is still on the conservative side. It's called a vacuum erection device, or VED. Most of us will call this the penis pump. If you recall, the Austin Powers movies, Austin Powers had one and it worked very well for him, and it can work very well for you as well. I like to tease my patients that the penis pumps can suck harder than your partner can for you. So it's a great way to get some blood flow in there. They come in various sizes. They come in both manual and electric versions. It's a very strong sucking power to pull blood into the penis. It can be used with the oral medications that we'll talk about, like Viagra or Cialis. Some downsides, bruising is a possible side effect because there's such a strong pull for the blood in there. You can use with a constriction ring. Some people refer to it as a cock ring. And then you can find the vacuum erection devices online. They're on Amazon even. AdamandEve.com is one of my favorite online sex stores. You can read reviews, you can find one in your price point, and kind of go from there. There are medical grade ones that are more expensive that you can get a prescription from your provider. Most of us in urology offices have those that we can prescribe for you. I've had most patients have success with getting them online for cheaper prices, but that still function and work very, very well. The constriction ring, cock ring, it's also known as a tension ring. It's basically a silicone band that you place on the base of the penis after you're erect. So get the erection either with stimulation or the vacuum erection device, roll the constriction ring onto the base of the penis, and that helps hold the blood into the penis while you're having sex. They come in variety packs, so there's usually 3, 4, 5 different sizes in a pack. So you can find one that fits tightly, that it helps keep the blood in there, but not so tight that it's causing pain. Again, bruising can certainly happen. You definitely want to remove it right after sex. I had a patient come in with a very purple penis because he fell asleep after sex and forgot to take the ring off, so don't do that. You can try the various sizes to find what works best for you. Just a couple pointers that might come up for you. Ejaculation can be restricted, so you might not get the full force of your ejaculation or the full fluid amount. So that's just something to know, but you will still get the orgasm. And that's fine. The ejaculate is either going to go up in the bladder and you'll pee it out later, or it's going to trickle out slowly. It just won't have the force with it. Both of those things are fine. And then the penis may feel cool to touch while you have the ring on. And that's just because of the restricted blood flow and pinching of the nerves that are in there. But it works really well for maintaining the erection. Okay, so get the erection first, then throw the cock ring on, use it while you're having sex, take it off as soon as you're done. And again, this can be used with the oral medications, okay? So if you're using Viagra and Cialis, go ahead and throw one of these on there and to maintain the erection better. The next least invasive treatment method is the ultrasound waves. It's a newer technology. It increases the blood flow to the penis through sound waves. It can take about 6 treatments or 2 months to see any improvement. It is very expensive and not covered by insurance. I've seen it anywhere from $3,000 to $5,000, and it may last up to 2 years. What I've seen in clinical practice is that it doesn't really do a whole hell of a lot. I've seen a couple patients where it worked for about 12 weeks. It works for very mild ED where you might not even really need the Viagra or Cialis yet. But again, it's very expensive. It's not long lasting. So whether or not you choose to do that is certainly up to you and your financial position. It's an option. For me, it's just not a very great option. The next one would be oral medications. Okay, so now you're going to take something to help you get this erection. The oral medications work with your body. They don't just pop the pill and boom, there's an erection. You have to be getting turned on and stimulated. It's just going to enhance your body's ability to get the erection and maintain it. The most common ones are Viagra, Cialis, Levitra, and Stendra. Levitra and Stendra aren't used as much anymore. They're pretty expensive and more difficult to get. Mostly it's Viagra and Cialis. So just to kind of break down Viagra a little bit, the generic name is sildenafil. So that's usually what you're going to see on your prescription. Or you can get these through the online pharmacies, at your urologist, your primary care. These are really pretty easy to obtain at this point and really not very expensive anymore. You can still use the GoodRx coupon if you want, if it's not covered by your insurance, but I say most of my patients probably pay between $20 and $30 a month for these at this point. So it's very much more affordable than it used to be. The Viagra works for about 4 to 6 hours. You want to take it on an empty stomach. You can take it up to once a day. And the range for the dosage is from 20 to 100 milligrams. So there are 20 milligram tablets. You can take up to 5 of those. There's also 50 milligram and 100 milligram tablets. So depending on where you're at with what you need, we can prescribe appropriately for you. Because it needs to be taken on an empty stomach, a lot of times I'll suggest to my guys, hey, if date night includes going out to dinner, go ahead and take the pill on an empty stomach before you get out to dinner. That way it can absorb correctly. And then it's still working in your system for 4 to 6 hours. So have your dinner, go home, make the magic happen. It's still going to be working in your system. So that's a great way to do that. And if you end up not having sex that night, you can go ahead and just pop another pill the next day when you need it. I do have some guys who it works well enough for them that if they take it in the evening, they can have sex in the evening and they still wake up with a morning erection, which is fantastic. And some of them don't on a regular basis. So having that with the Viagra is really helpful and they can have sex again in the morning. The Cialis is a little bit different. It doesn't matter if you take it on an empty stomach or not, which is great. It can last about 36 hours in your system, some guys up to 48. And so you don't have to take it quite as often. It gives you a little bit more spontaneity. You can pop it this morning and maybe have sex later today, or maybe you guys get in a fight and you're not going to have sex till tomorrow. Now you don't need to pop another pill because this one is still working. Most of our guys take it about every 2 to 3 days. You can take it regularly every 3 days. You can take it as needed when you think you're going to have sex. Some of our guys, I have a patient who has an out-of-town girlfriend, so they only see each other on the weekends. And so Friday, Saturday, Sunday, he pops one Friday afternoon and he's good for the whole weekend. So that's kind of a nice thing about the Cialis. The generic name of Cialis is tadalafil, so that is most likely what you're going to see on your prescription. There are side effects of these medications, okay? So they are relatively safe, but they do have side effects, so you need to be aware of those. Headache is probably the most common. Guys who take the Viagra, it's going to last shorter because the medication lasts shorter, so your side effects are going to last shorter. So a lot of my guys will tell me they take Tylenol at the same time that they take the Viagra, and that can help with the headache. You can also get blurry vision. Some of the guys describe it as blue vision. You can get flushing of your skin or congestion, like a stuffy nose. You can have changes in your heart rate or your blood pressure. Some guys get heartburn or GI upset. And the biggest thing with these medications is you cannot take them with nitroglycerin or similar medications. So if you take nitroglycerin for your blood pressure or chest pain, you cannot take these medications. If you have taken one of these medications and you develop chest pain, you need to tell the emergency services, ER physicians, whoever, that you have taken one of these so they can treat you appropriately. The combination of nitroglycerin and these medications can drop your blood pressure very, very dangerously low. And so we don't want that happening. So don't mix and match, okay? Make sure that you have this prescribed by a provider who has looked through all of your medications and goes through this with you, okay? That could be your primary care, it could be your urologist, whoever you get that through, just make sure they're aware. If you are on blood pressure medications, heart medications that you're not sure whether or not there's gonna interact, talk to your cardiologist or your provider of the Viagra or Cialis to see whether or not it's safe for you. Muse is another option. It's not used very often anymore because there's some issues with it, but it is a suppository that you put into the urethra of the penis, so the opening where your pee comes out. It's a little squishy applicator. You put it in there, squirt the medicine in, and it starts working within about 10 minutes to give you an erection. It can last 30 to 60 minutes. There's been some issues with it causing a lot of burning, both while the medicine is in there and afterwards when you're urinating. And it can also cause damage because you're certainly putting something in an out hole. So there can be some issues with that as well. So it's not used often. It is an option out there, but just be careful if you're going to use that option. Intracavernosal injection, ICI. Penis injection. Okay, this is going to go right into those blood vessels. So remember, I said you have two blood vessels in your penis that get you hard and they communicate with each other, meaning you only have to give yourself one injection and that medication is going to go throughout the entire penis. These can be self-injection with a pre-filled injector, like Edex is a brand that does that. There's also ones that come in vials that you draw up, much like an insulin. That can be trimix or quadmix. These are made at compounding pharmacies. So you're not going to get this at a regular Walgreens or CVS. It has to come from a compounding pharmacy. So getting this from your urologist is really important because they'll know which pharmacist to go to. A good urologist is also going to give you a demonstration. I bring all of my guys in. We do an injection in the office. We go through the training. I give them a sheet with all of the information to take home so they can reread everything. And I follow up with them to make sure things are going well. So make sure that you have someone who's teaching you how to do this. You want to inject about 10 minutes before you want to have sex. Some of these medications need to be kept in the fridge or the freezer, so make sure you're looking for that direction. What it does is it increases blood flow. One of the components of it is a prostaglandin. We have those already in our body and they help us bleed. So if I stuck you in your thumb would swell up with blood. We stick you in your penis, so your penis swells up with blood, okay? Your partner can inject. If you have a large belly or arthritis, you can't see your penis, you can't reach it correctly, you can have your partner inject it for you. You're going to inject either at 3 o'clock or 9 o'clock on the sides of the shaft of the penis. You don't want to do the head of the penis. You don't want to go in your belly, and you don't want to go top or bottom, like 12 or 6 o'clock, excuse me. Those areas make it more likely to accidentally get into the urethra. We don't want that. So you go 3 and 9 o'clock on the sides of the penis, kind of move around as to where you're injecting it each time. There are some limitations to this medication. So you can do 1 time a day, 2 days in a row, or 3 times in a week. We really want those blood vessels to relax between uses. Okay. Definitely giving yourself that break will help with that. But you can have sex Friday and Saturday and just take a break on Sunday. So it's a really great option. A lot of guys are very scared of this option because no one wants to think about stabbing themselves in the penis with a needle. What I will tell you is it's an extremely small needle. I have only had one of my guys that I've done a demonstration on tell me it's not worth the erection. Most of them are very happy to do it. They're very surprised when we do it that it isn't really that big of a deal. Some of the guys tell me the medicine burns for a few seconds. Most guys tell me they don't feel anything. So it's a great option there. Lastly, we have a penile implant. It's short version is called an IPP. It is a surgery that you go through. The tubes, there's two different types. There's a malleable where there's you just bend them. You bring it up when you want to have an erection, you bend it down when you don't. And then there's a 3-piece that is actually a pump version. So the malleable is really great for people who have arthritis. If you are recovering from a priapism and you're waiting to get a 3-piece pump, you can have a malleable in the meantime to hold everything open. And it can be great for somebody who maybe doesn't have a lot of sex, but just wants a little bit of rigidity there for masturbation or very infrequent sex. The 3-piece has a fluid reservoir that we bury in a fat pocket in the groin area. It has a pump that goes in your scrotum, and then it has 2 tubes that replace the blood vessels that you currently have. And so when you're ready to have the erection, you hold in the scrotum where the pump is and you pump it. And the fluid goes from the reservoir into the tubes and gives you a nice hard erection. Have sex for as long as you want, walk around the house with it erect. I don't care what you do, but you can keep it erect as long as you want. When you're done, you go back to the scrotum, you hit the release valve, and the fluid then goes from the tubes back into the reservoir. So it's a really great option. A lot of our guys post-prostatectomy who don't regain their ability to have erections will use this. Guys who suffer from really bad diabetes or neuropathies will have great success with this. You're down for about a week after the surgery with some fairly significant pain. We don't want you lifting heavy things or anything like that. After a week, most of my guys have said that they're in pretty good shape. They don't have too many problems. And then they come back into the office at about 4 to 6 weeks after surgery, and we teach them how to use it. And then they have very successful sex lives. And they're very excited about it. Their partners are always excited and have fun coming back into the follow-up appointments and telling me their sex stories and how the pump is working for them. So it's a great option for those guys who the medication and the injections are no longer working for, or who are needle phobic and don't want to use the injections, or have maybe they're taking nitroglycerin, so they can't use the Viagra or Cialis. So it gives another option for how to be able to have erections. So the one downside that we have to talk about with erectile dysfunction is priapism. So if you use medication, you can get a long-lasting erection that does not feel good. Okay, this is not the erection that lasts 30 or 40 minutes while you're having a really nice, long, fun session. This is a rock hard, 100% erection, looking like a towel rack. It is not going down at all, and it is painful. Okay, this is a side effect that can happen with Viagra or Cialis. It is a side effect that can happen with the injections. It is considered a medical emergency. If you do not get this reversed, it may prevent you from getting erections in the future. That blood in there can clot off and cause some problems. So at an hour, if you are rock hard, it is not coming down at all, and you are done having sex, take some Sudafed. Sudafed is a vasoconstrictor, meaning it's going to help push that blood out of the penis. Okay. Some of you might not be able to take Sudafed based on other conditions that are going on, so use some caution there, but that's a great way to start working on the priapism. If you are still rock hard, 100% towel racking at 3 hours, that's when I want you to go to the emergency room. All the commercials for Viagra and Cialis are going to tell you 4 hours. The reason I say 3 is because you got to drive to the emergency room. You got to get checked in. They got to get us on board. Sometimes the ER physicians or providers will help and do this procedure. Other times they're going to call urology. We are not always in the building, so sometimes we have to come in. We have to get the medicines ready and get everything ready. So 3 hours, head to the emergency room. If it happens to go down while you're on your way or waiting for us to reverse it, fantastic. But if it doesn't, then we're there and we're getting things done. We may have to irrigate out the blood and really suck that blood out with a needle to get the clots out. We may need to just use phenylephrine, which can reverse it. And sometimes we have to do surgery and actually go in there and clean the blood clots out. And that would be when we would put a malleable penile implant in to hold you over until we can talk to you about, further surgery and doing either keeping the malleable or getting you a 3-piece. I brought toys home with me from work to show you this. So if you are going to stick around and want to pop over to our YouTube page where I have video along with the podcast, I will go ahead and go over some of these things that I've just talked to you about so you can actually see them. So I'm really excited to be able to show those to you. So head on over to our YouTube channel and watch Between the Sheets over there so you can see what I've been explaining to you. I'm super excited to show you some of the things that I have been talking about. So let's get started with the vacuum erection devices. I brought two. So this is a manual one. You put it on over the flaccid penis up against your belly, and then you get a good seal on your belly and you pump. So you can hear that that's a good suction, okay? So that's what I mean by it sucks harder than we can for you. It works really, really well. So that's the manual version where you pump it yourself. And then there is a battery operated version where you can see if you can hear that noise on here. Okay, so again, over the flaccid penis, make a really good seal. It takes a little bit longer, I think, with the battery powered ones, but some guys, especially with arthritis and stuff, can't necessarily do the pump. You put this on, it sucks it for you, and then when you're done, you hit the off button. That's a great option. All of them come with different sizes so that depending on your girth, you can have adequate suction. So that's really great. And then they come with cock rings as well. So the silicone band that I talked about, they come in all different sizes. Sometimes you can buy them without these little flappy things on the side and just the ring. So that's really great. But you put it on to the base of the penis after it's erect, and it stays on until you're done having sex. And then you just pull it off. Good to go. So that's a cock ring. They're also known as constriction rings or tension rings. So those are really cool as well. I did not bring any injection material, but basically what you're going to do with the injection is go through not the head of the penis up here, which is the glands, and not into your belly. You're going to go on the shaft of the penis, either at 3 o'clock or 9 o'clock to inject here. And you're going to put the needle all the way in, put in the medication, pull the needle out, and then in about 10 minutes, you'll have a nice good erection. Okay? The last option that we talked about that I'm going to show you is the penis pump. I didn't bring the malleables, but basically they go in there and you can put them up when you're ready to have sex, bend it down when you're done, okay? I did bring both that pump that you just saw has a pump inside, or that penis that you just saw has a pump inside of it. And then this also is what they look like. So there's two companies that my docs use, Coloplast and Boston. So this is from Coloplast. This is their 3-piece. So this is the fluid reservoir that we bury in the fat pad right by your groin. These are the tubes that go into the penis. And this is the bulb or pump that goes in your penis. So when you're flaccid, these are very empty, okay? And then, let me just throw these back in here so you can see. When I pump this, the fluid goes from the reservoir into the tubes and you get an erection. It can take like 10 pumps or so, but you definitely get a good erection with these. You can see them filling there. There, they're getting full. All right, so this is a nice hard erection. You can even probably give it 1 or 2 more pumps. And you can hear now, as this is the fluid reservoir is empty. Then when you're done, the top of the pump has a release valve. You just have to push it once, and then because these aren't in a penis, I would squeeze them a little bit, and you would not have to do that because it's inside your penis, and the fluid would go back up into the reservoir. Boston Scientific also makes this product slightly differently, and that's who I have like in the penis here. This is by Boston. So I'm going to grab down here into the balls in scrotum. So you have the testicle here, pump is in the middle. So as you're pumping, the fluid is going from the reservoir into the penis. And again, about 8 to 10 pumps. And you can see it getting erect here. So it can be part of your foreplay. I have patients who will be getting oral sex while their partner does the pumping for them, or a hand job, something like that, just to make it a little bit more playful than so scientific of sitting here and doing the pump. But you can see, look at that nice erection. You could definitely have sex with that, okay? And then hit the release valve. There it is, okay? and the penis is going to go back down. Now, again, this isn't into someone, so I might have to squeeze it a little bit to get it to go all the way down. But it does go flaccid again. Okay, so that's really pretty cool. I love these tools. I love that we have these options for our men that have erection issues. So hopefully you learned a lot today and can take these with you. Send your friends on over when they want to learn too. It's time for my favorite segment of the show, Between the Sheet Shenanigans. We've got some great stories for you, and as always, the details of the stories will be changed so that you cannot identify who the owner of the story is. It might be my story, might be my friends or family members, or even a patient's story, but you're not going to be able to tell. Please send in your stories as well so we can shake up the details and share your stories. Send them into podcastbetweenthesheets@gmail.com. Let's tell some stories. All right, erectile dysfunction stories. I have plenty of these, but I picked a few of my favorite. I had a patient who came in for erectile dysfunction. He had not had sex in 2 years because he could not get an erection. He was nervous to try medications. He was nervous to talk to his partner about it. And they had kind of just gone through life with other things without necessarily having penetrative sex. And so he was very excited to come in and get a medication that he could afford because it is affordable now. So we got him started on Viagra. It worked wonderful for him. He is a person who does not get side effects from it, which is great. He has successful erections. He has not had a priapism event, and he is very, very happy with that. I have seen him multiple years in a row now, and it is still working well for him. So that's fantastic news. I had a couple come in not too long ago to learn how to do the injections. And they were so much fun. Oh my goodness. So they have only been married for 12 years. They're later in life second marriages. And he is had prostate cancer, had his prostate removed. And so he did not fully recover his ability to get erections. The Viagra and Cialis aren't doing jack shit for him. So brought them in to do this, and he was so cute joking around with her, and she was joking around with him, and so you could tell they just have a really great relationship, and communication is there. And he was teasing me that he's going to need one prescription of the medication to keep at his wife's house and one for the girlfriend's house. And the wife just looked at him and said, good, because I don't want to have to put up with you all the time anyway. So it was just really fun. It was great to be able to have that experience with them. I taught her how to do the injections. She had nursing experience in her background, and so that worked really well for them. And they're very excited. They were ready to go out and have a good weekend. I think I did it on a Thursday or a Friday for them. And so they were pretty excited to be able to try it out over the weekend. And I have not had a follow-up with them, but I expect good reports when they come back. Most of my patients with the penile prosthesis, so I don't do the surgeries. I have 2 surgeons in my office that do, but I do a lot of the pre-surgery and most of the post-op surgeries, post-op with the patients. So I do their activations. I teach them how to use the pumps and all of that. I do their follow-up several months after to make sure everything is working well. So I get to know these patients really well and hear their stories, and they're just really fun. I've had some of them leave and have sex in our parking lot because they haven't had sex in several years, and all of a sudden he can get an erection. We had some that came from several hours away to have the surgery. And so when they came in for their follow-up, they had gotten a hotel to be able to go and have sex right after their appointment because they knew it would be 3 or 4 hours before they got home, and they were that excited to try it out. I have had wives come back in and say, oh my gosh, this is the best thing ever. He stays hard even if he climaxes. If I'm not done yet, he can keep going. So it's really fun. It's great to hear these stories and have them come back in and share them with me. I had a guy in his 30s that had a priapism after taking some Viagra, and he waited 36 hours to go to the emergency room. So please don't do that. He ended up with a penile prosthesis, and he's only in his 30s. The penile prosthesis lasts for about 10 to 15 years. So he's going to go through multiple in his lifetime because he didn't take it seriously and was too embarrassed to go in and get help right away. So don't be like him. Go get help. We can help you. We can reverse it. It's not pleasant, but it's going to help you maintain your ability to have erections going forward. My last story for you today is I had a friend who I have known for years and years and years since high school, married to another friend of mine, and the husband called me. Very rare for him to reach out to me and call me, but answered and said, "Hey, what can I do for you?" And he said, "Well, I want to talk to you about something. I think it's related to what you do for work." And I said, "Sure, what's going on?" And of course, it was erections. And he said that this is a new thing for him. It hasn't happened before. He's not sure what's going on. So I talked through, like, are you stressed? Are you this? Are you that? Have you had any changes in medication? Anything else? And of course, like a typical man, he hasn't been to the doctor in many, many years. So we have no idea if he has high blood pressure or diabetes or anything like that. And he is under some stress. He owns his own business. But he was really frustrated because it happened a couple of times and he really wants to be able to please his wife. And that's what he told me. And she's my friend. So obviously I want her to be pleased and have a good sex life as well. So I got his permission to talk to my other friend and his wife, and we kind of talked through it, and they both decided that yes, they do want to try some medication and just see if that will help, whether it is a short-term fix or a long-term fix. They're not really sure yet. And it also got him to agree to go and have a physical. So that was a really positive outcome. But this moral of the story is that the Viagra is working for him. He's very happy. They're back to having great sex, and he's back to being happy that he can please his wife. So it's awesome. There are plenty of treatments out there for erectile dysfunction. We can tailor them to you. Do not be embarrassed or afraid. Greater than 50% of men deal with erectile dysfunction throughout their life, and we have the tools to help you. So hopefully this was really educational for you, and you can reach out to myself or your provider wherever you are and get the help that you need to maintain your sex life and have some really fun times. Thank you for listening and spending time with me today. You can catch new episodes of Between the Sheets every Wednesday, because what better way to add some spice to your life than to have a new podcast on Hump Day? We will continue to explore common, uncommon, and taboo topics related to sexual health and wellness. Please send any comments, questions, or stories to podcastbetweenthesheets@gmail.com. That's all one word, podcastbetweenthesheets@gmail.com. Have a great day. And remember how important it is to discuss these topics with your friends, your family, and of course your partners. In fact, you can like, follow, and share this podcast so they can see it too. See you next time for more sexual health topics. Between the Sheets.